Good morning. My name is Dr. Prabhakar. Today we are going to discuss about the Tamil Nadu Dr. MGR Medical University February 2021 Physiology Paper2 first 10 MCQs. Okay. This MCQ discussion will helpful to attend your university examination. Each paper you are having the 20 MCQs. You have to attend the 20 MCQs within the 30 minutes. 30 minutes. Okay. If you are attending the marking the correct answer, you have to read full question and all the options. Then only you have to select the correct answer. You should not rewrite the answer script. That is the important point. Now we have to move to the question. First question is the little tough question only. The question is the property of specificity of nerve fibers for transmitting only one modality of sensation is. They gave 4 options. First option, law of projection. What is law of projection? If you stimulate the sensory pathway anywhere, the sensation perceived in the receptor area. That is the law of projection. This will explain the phantom limb phenomenon. So this is not the correct answer. So this is not the correct answer. Second option is spatial summation. What is spatial summation? Instead of stimulating the postsynaptic membrane repeatedly, 2 or 3 neurons simultaneously stimulate the postsynaptic membrane is called as the spatial summation. So this is also not the correct answer. Third, labeled line principle. So sensory neuron devoted to carry the particular sensory modality of sensation. So this is the little bit correct answer. Labeled line principle. So touch sensation carried by the neurons of the touch pathway, dorsal column pathway. Pain sensation carried by the spinothalamic tract. So this is the little bit correct answer. Okay. So this is the correct answer. What is Weber-Spechner's law? Weber-Spechner's law is the magnitude of sensation is directly proportional to the intensity of the stimulus. So that is the wrong option. So you have to know how to omit the distractors. This will helpful to attend the MCQs in PG exam also. Okay, so you have to practice it now itself. Only you should not take the answer immediately, blindly. You have to omit the other options. Okay. Second question is the easiest question. All of you immediately choose the correct answer. The hypothalamic nucleus that controls food intake called as feeding center is. First option A, lateral hypothalamus. Lateral hypothalamus is the feeding center. So this is the correct answer. So other options, posterior hypothalamus. Posterior hypothalamus is the heat gain center for the temperature regulation. Anterior hypothalamus is the heat loss center for the temperature regulation. Option D, is ventromedial nucleus. Ventromedial nucleus is the satiety center. Satiety means fulfillment or satisfaction after the food intake is the satiety. So ventromedial nucleus is the satiety center. Third MCQ. The intrafusal fibers of muscle spindle is supplied by option A, alba-motor neuron. Alba-motor neuron is the largest motor neuron. This is supplies to the extrafusal fibers. So this is the wrong answer. Second option is the gamma motor neuron. So gamma motor neuron is the small neuron. It supplies the intrafusal fiber. So this is the right answer. Option C is the dorsal root neuron. Dorsal root neurons are the first order neuron for the sensory pathway. This is not the correct option. Already we know the answer. Rensa cell is the feedback neuron. Inhibitory feedback neuron is the Rensa cell neuron. This is the wrong answer. Correct answer is the gamma motor neuron. Fourth question, also easiest question. The neurotransmitter that is excitatory is glycine. A, option A, glycine. This is the inhibitory neurotransmitter. Option B, glutamate. This is the excitatory neurotransmitter. So this is the correct answer. You go to see the other distractor. Third one is serotonin. Serotonin also inhibitory neurotransmitter. And dopamine. Dopamine also mainly inhibitory neurotransmitter. So correct answer is glutamate. Fifth MCQ. In which stage of sleep spindles and K complexes are seen in electroencephalogram. Okay. What is sleep spindle? So burst like alpha-like wave-like activity seen in the rhythmic waveform is the sleep spindle. K complex is one or two high voltage complexes seen in the rhythmic waveform. So which stage we can see the this pattern, sleep spindle and K complexes. Stage option A, REM sleep. So we cannot see the sleep spindle in this stage. Second option, stage 2 NREM sleep. So normally we can see the sleep spindle K complex seen in stage 2 NREM sleep. This is the correct answer. Okay. So others are distracted. Stage 2 NREM sleep, we can see the sleep spindle and K complexes. Sixth MCQ, the increase in heart rate following on increase in atrial pressure is called. Note the word atrial. Okay. Option A is Cushing reflex. Cushing reflex is associated with the increase the intracranial tension with relative bradycardia. So this is the wrong answer. Volume reflex. Volume reflex is the increase in blood volume associated with decreases the ADH hormone, antidiuretic hormone, and decreases the angiotensin 2 and increases the atrial natriuretic peptide. This is the volume reflex. This is the wrong answer. Option C is the pain bridge reflex. Atrial stretching during the intravenous administration of the saline increases the heart rate is the pain bridge reflex. So this is the correct answer. Fourth option is the baroreceptor reflex. Baroreceptor reflex. Baroreceptor located in the aortic arch and carotid sinus. It responds to the change in the various posture and changing the BP. It regulates the blood pressure within the 15 seconds. So correct answer is the pain bridge reflex. Seventh MCQ, the substance that can cause vasodilatation of blood vessel is option A, norepinephrine. Norepinephrine produces a vasoconstriction. So wrong answer. Option B, angiotensin 2. Angiotensin 2 also produce vasoconstriction. So this is also wrong answer. Option C, vasopressin. Vasopressin, name itself it is pressor. So it is produce a vasoconstriction. This is also wrong answer. Option D, bradykinin. Bradykinin found in plasma. So it produces the vasodilatation. So this is the correct answer. Correct answer is the bradykinin. 8th MCQ. Tall tented T wave in electrocardiogram is seen in option A, hypocalcemia. In hypocalcemia, the electrocardiogram we can see the prolongation of the QT interval. So this is the wrong answer. Option P, hypokalemia. The hypokalemia in the electrocardiogram we can see the U wave. So this is the wrong answer. Option C, hypernatremia. The hypernatremia we cannot see the significant electrocardiogram changes. So this is not the answer. Option T, hyperkalemia. The hyperkalemia we can see the tall peak tented T waves. So this is the correct answer. So hyperkalemia is the correct answer. 9th MCQ. The condition that causes low cardiac output is option A, anemia. Anemia produces a high cardiac output. Option B, beriberi. Beriberi due to the thiamine deficiency, it is also produces a high cardiac output. Option C, arteriovenous fistula. It is also having the high cardiac output. Option D, mitral stenosis. So this is the correct answer. So it has the low cardiac output. So mitral stenosis is the correct answer. The 10th MCQ, the tastant which has caught highest threshold is, tastant means water soluble taste substance. So option A, the threshold concentration for the hydrochloric acid is the 100 micromole per liter. So this is the wrong answer. Option B, strychnine hydrochloride. This has the threshold around 1.6 micromole per liter. This is the wrong answer. Option C, sucrose. It has the threshold around 10,000 micromole per liter. This is also not the correct answer. Option D, glucose. It has the highest threshold value, 80,000 micromole per liter. So this is the correct answer. Within the 15 minutes, we have discussed the 10 MCQ. I hope you will enjoy this video. You learn something from the 10 MCQs. Next 10 MCQ I will play in the next video. If you like this video, you subscribe and share your friends. Thank you.